We're diving into one of the most talked about topics in modern healthcare, whether AI tools like ChatGPT can really help with medical advice and what the benefits, risks, and future implications might be. We'll be breaking down insights from recent expert discussions and research so you can clearly understand what's happening behind the scenes and how it affects you. Before we get started, if you find this content helpful, make sure to like this video and subscribe to our channel for more science-based health updates. Also, don't forget to check the description box below for all sources and references used in today's discussion, so you can explore the original material yourself. Hello, I'm Pamela. I analyze the latest research on blood pressure, diabetes, and cardiovascular disease, translating complex scientific findings into clear, practical insights through educational video content. And today, I'm expanding that mission to include a topic that's rapidly reshaping how people search for and consume health information: artificial intelligence-powered medical guidance. Let's start with the reality that millions of people around the world are already using AI tools every single day to ask health-related questions. OpenAI recently introduced a new feature called ChatGPT Health, which is designed specifically to support health and wellness inquiries. This move didn't come out of nowhere. Reports suggest that ChatGPT was already receiving tens of millions of health-related questions daily. People are uploading lab results, asking about symptoms, looking for medication explanations, and trying to understand diagnoses. In other words, the demand for fast, conversational, and accessible health information has exploded. From a user perspective, this makes sense. Many people want immediate answers. They may not want to wait days or weeks for a doctor's appointment just to understand what a lab value means or why a certain symptom might be happening. AI offers speed, convenience, and accessibility. You can ask a question at midnight and get a response within seconds. For people who feel uncomfortable asking certain questions in person, AI can feel less intimidating. But convenience alone does not guarantee safety or accuracy, and that's where things become complicated. Experts in clinical medicine and artificial intelligence have raised important points about how tools like ChatGPT Health should and should not be used. One of the most critical ideas is that AI should be used for preparation, not diagnosis. That means you can use it to organize your thoughts before a doctor's visit, understand medical terminology, track patterns in your health data, or create a list of questions to ask your healthcare provider. What you should not do is use it to decide what condition you have, predict future outcomes, or choose treatments. AI tools do not have access to your full medical history, physical exam findings, or the nuanced context that doctors use when making clinical decisions. When AI provides confident-sounding answers, it can create a false sense of certainty that may lead people to make poor or even dangerous choices. Another major principle is verification. Any AI-generated information that could influence a medical decision should be treated as a preliminary suggestion, not a final answer. It should always be confirmed with a qualified healthcare professional. Healthcare is complex, and even trained professionals rely on multiple sources of information, clinical guidelines, and peer-reviewed evidence. AI models, on the other hand, generate responses based on patterns in data. They do not truly understand medicine in the way humans do. They predict plausible text, not verified truth. Privacy is another area where many users misunderstand the risks. When you talk to your doctor, your conversation is protected under healthcare privacy laws such as HIPAA in the United States. When you share personal health information with consumer AI tools, those same protections do not apply. That means sensitive data related to mental health, reproductive health, substance use, or genetic information could potentially be accessed through legal processes or used in ways you did not intend. Even if companies implement strong privacy policies, the legal protections are not the same as those governing medical professionals. This is an especially important issue in regions where certain health topics carry legal or social consequences. One of the biggest misconceptions people have is that AI-generated health information is equivalent to getting a second opinion from a doctor. It is not. A second opinion involves another trained clinician reviewing your medical history, lab results, imaging, and physical exam findings. AI does not have that comprehensive context. It does not weigh evidence in the same way. It does not account for your personal preferences, lifestyle factors, or subtle symptoms that might only emerge during a real conversation. Perhaps most importantly, AI does not carry accountability. When a doctor makes a mistake, there are professional and legal systems in place to address it. When AI is wrong, the only feedback mechanism is often a simple thumbs down button. Looking toward the future, experts expect AI to become deeply integrated into healthcare workflows. This doesn't mean doctors will be replaced. Instead, AI is likely to serve as an additional layer that supports both clinicians and patients. Behind the scenes, AI can help with documentation, highlight relevant parts of a patient's medical history, and flag potential issues. For patients, AI tools may function as ongoing health companions that help track lab trends, remind users about preventive care tasks, and assist with appointment preparation. What won't change is the core of the patient-doctor relationship. Trust, clinical judgment, empathy, and shared decision-making cannot be automated. The most successful healthcare environments in the future will likely involve AI-assisted physicians working with AI-informed patients. When both sides use technology responsibly, it can lead to more productive conversations in less time. On the other hand, clinicians who completely avoid AI may find that patients are already using it independently and simply not sharing that information during appointments. One reason the launch of ChatGPT Health is so significant is that it formalizes behavior that was already happening. Millions of people were already using ChatGPT informally to ask health questions. Now, dedicated infrastructure is being built around that usage, including better data handling systems and guardrails designed to reduce harmful outcomes. At the same time, healthcare laws are increasingly requiring patients to have digital access to their medical records. This means tools like ChatGPT Health could eventually integrate with standardized medical data systems, giving users a more comprehensive view of their own health information. Compared to traditional search engines, AI chatbots offer a different experience. Instead of scrolling through pages of conflicting links, users receive synthesized responses tailored to their input. For example, instead of just listing possible causes of a symptom, AI might connect that symptom with recent lab trends or medication use. This personalization is one of the strongest advantages of conversational AI. However, it also comes with risks. AI can hallucinate, meaning it can generate false information that sounds convincing. It may cite sources that do not exist or misinterpret data. It also lacks access to physical exams and subtle clinical cues that doctors rely on every day. Another major concern is the lack of accountability. When clinicians provide care, their decisions are subject to professional review, licensing standards, and legal oversight. AI systems do not operate under the same framework. This creates a gap in responsibility that users must understand. Just because an answer sounds confident does not mean it is correct. So how are people actually using ChatGPT for health? Experts describe several high-value use cases. One is pre-visit preparation, where patients use AI to understand lab results and organize questions before seeing their doctor. Another is post-visit clarification, such as asking for simpler explanations of medical terms discussed during an appointment. Some people use AI for regular check-ins, asking for reminders about health-related tasks or lifestyle habits. Others use it to navigate healthcare systems, such as comparing insurance options or appealing coverage decisions. AI is also used for general health education, helping people understand basic medical concepts. However, extra caution is needed in sensitive areas like mental health and reproductive care. There have been documented cases where AI chatbots failed to respond appropriately to users experiencing mental health crises. Unlike trained mental health professionals, AI systems are not designed to recognize emotional decompensation or escalate urgent situations effectively. In reproductive health, especially in regions with legal restrictions, digital records of health-related conversations could carry legal risk. The same applies to topics like substance use, HIV status, and genetic testing. Now let's shift to the question of reliability. Research shows that ChatGPT performs well in certain areas and poorly in others. It excels at defining medical terms and translating complex language into simpler explanations. In fact, studies have shown that ChatGPT can outperform some healthcare professionals when it comes to simplifying technical terminology for the general public. This makes it a powerful educational tool. However, when it comes to more complex tasks, accuracy becomes inconsistent. Reviews of multiple studies have found that ChatGPT's performance can range widely, from very accurate in some contexts to highly unreliable in others. It may provide reasonable general recommendations, but struggle with nuanced clinical decisions. It may interpret symptoms accurately in some cases, but provide incomplete or oversimplified responses in others. This variability makes it risky to rely on AI for direct medical decision-making. There are clear benefits to using ChatGPT for health information. Accessibility is a major one. People can access it anytime, anywhere, as long as they have an internet connection. This is particularly helpful in regions with limited access to healthcare providers. Another benefit is education. AI can help people understand medical topics they might otherwise find confusing or intimidating. It can also provide emotional reassurance by answering basic questions quickly, which may reduce health-related anxiety in some situations. At the same time, there are significant drawbacks. Inaccuracy and misinformation remain major concerns. AI models are trained on large data sets that include both reliable and unreliable sources. This means the quality of information can vary. There is also the issue of lack of personalization. Doctors use physical exams, lab tests, imaging, and years of training to interpret a patient's condition. AI cannot replicate that level of individualized assessment. Bias is another challenge. Because AI reflects patterns in its training data, it can reproduce existing biases in healthcare information, potentially worsening health disparities. Hallucinations, or confidently presented false information, are especially dangerous in a medical context. When an AI system provides incorrect advice with high confidence, users may not question it. This can lead to delayed treatment, unnecessary anxiety, or harmful self-management decisions. There is also the concern that excessive reliance on AI could reduce meaningful human interaction in healthcare, which is essential for managing chronic conditions and serious illnesses. If you choose to use ChatGPT for health-related questions, there are ways to do so more safely. Being specific helps. Clear, detailed questions are more likely to produce useful responses. Adding context, such as age, general health status, and relevant background information, can improve the quality of answers. Adjusting the tone of responses can also be helpful. If medical language feels too technical, you can ask for simpler explanations. You can also define the type of response you want. For example, you might request a list format, step-by-step guidance, or examples. Asking for reputable sources can help guide the AI toward more reliable information, although it's still important to verify those sources independently. And finally, asking follow-up questions can clarify confusing points and improve your understanding. Despite all of these tools and strategies, one message remains clear. AI should not replace professional medical advice. It can support education and preparation, but it cannot substitute for a trained healthcare provider. If you have concerning symptoms, new health issues, or complex medical conditions, speaking directly with a qualified professional is essential. As we move forward, the relationship between humans and AI in healthcare will continue to evolve. Used responsibly, AI has the potential to improve health literacy, empower patients, and streamline healthcare processes. Used carelessly, it can spread misinformation, compromise privacy, and create false confidence. The key lies in understanding both its capabilities and its limitations. So the next time you consider asking an AI chatbot about a health concern, remember this: use it as a starting point, not a final authority. Let it help you learn, prepare, and organize your thoughts. But always bring those insights back to your healthcare provider for proper evaluation and guidance. If you found this discussion helpful and informative, please take a moment to like this video and subscribe to the channel. Your support helps us continue creating evidence-based, easy-to-understand health content. And once again, be sure to check the description box below for all the sources and references used in today's video so you can explore the original research and expert opinions in more detail. Thank you for watching, stay informed, stay curious, and I'll see you in the next video.